Hi, I'm Dr. Heather Hirsch, and in this video, we're going to cover a topic that I get all the time. How do I know when my HRT is really working? And in fact, such a big part of my job as a menopause expert, a menopause doctor, is to help my patients with this very decision, because it's not simple as being black or white, yes or no. So if you're interested in how I help my patients determine if their HRT is working, definitely stick around. If you don't know me, I'm Dr. Heather Hirsch. I now have a private telemedicine practice and previously founded the Menopause Clinic at Harvard. Now, I also wrote a book, Unlock Your Menopause Type, which is a great way to just pick my brain if you can't get in to see me as a patient, but I would love to see you to give you individualized care one-on-one, and the links for all that will be in the description bar below. The first way that we really know that your HRT is working for you is that there is a 70 to 80% improvement in your symptoms. Now, I came up with this myself over a decade of treating women through menopause. And the reason is this: one, is absolutely achievable. And number two, if you are taking hormone replacement therapy, we want it to be having lots of benefits for you. You know, there used to be this mantra of the lowest dose that works, and a lot of doctors heard the lowest dose. My mantra is the lowest dose that works, which sometimes isn't the lowest dose out of the box of options. 70 to 80% improvement at minimum is a absolutely reasonable goal. So I always tell my patients that when we're first starting hormone replacement therapy, so that they can keep that in their mind. And every time I see them for follow-up, I really help to gauge and ask them, are you getting 70 to 80% improvement? Now, sometimes patients will say, can I get 95% improvement, 100% improvement? I would love that. And yes, sometimes that is absolutely possible. But the minimum is really 70 to 80% improvement. I will not stop adjusting or changing your HRT until we get there. A little word on dosage. There's this idea that if you increase the dose of hormone replacement therapy, that is riskier, or that you're going to be at bigger risk, right? Because it's riskier, or that you're just more severe, or your symptoms are just out of control. And none of that is true. What I always tell my patients is that my neighbor could be on the lowest dose of the patch, and that neighbor over here could be on the highest dose of the patch, and they both feel 70 to 80% better. And we both use their serum levels of somewhere between 40 to 70 picograms per ml, and at that dose is where they both get a therapeutic level, but they're on two different doses. The way we metabolize hormones is completely individualized. The way our proteins change, our DNA changes, all of these little things that happen deep under the surface have nothing to do with the number on the box. And we know that if your dose is increased, you're not at increased risk, again, particularly if you're in that therapeutic range. So one woman might need a drop of it to be in therapeutic range, and another may need a bigger dose, but also still be in therapeutic range. So 70 to 80% is nearly always the goal. Another way we can check this is by checking your estradiol-free levels in your bloodstream. Now, this is not super straightforward if you're in perimenopause. So if you're in perimenopause and using postmenopausal hormone therapy, this really won't apply to you because you're still making some of your own estrogen, and therefore you can have volatile levels sometimes. But if you're postmenopausal and you're using menopausal hormone therapy, the goal of hormone therapy in the bloodstream and estradiol-free level should be between 40 and 70 picograms per ml. Now, if you're younger, if you've had premature menopause, early menopause, or premature or early surgical menopause, that number can actually float a little bit higher, somewhere into the 100s or even 120 pgs per ml. But I use that as well to help my patients see if they're ultimately in that therapeutic window. Second, are we minimizing any side effects from hormone replacement therapy? So side effects typically with hormone therapy tend to be breast tenderness and bleeding. Now, if you don't have a uterus or you have an IUD or you've had an ablation, you might be able to cross bleeding off of your list. But one of the things that HRT certainly can do is cause some bleeding, breast tenderness, or sometimes other side effects. Those tend to be the big ones. Sometimes I hear a little bit of nausea or a little bit of bloating. Now, sometimes it's hard to know if it's from the estrogen or from the progesterone. And so what I often sometimes do is separate those out for patients to determine what is actually causing the side effect. But you really want 70 to 80% improvement, which was our number one point, with very minimal to no side effects. Thirdly, you want to be able to be consistent with your hormone replacement therapy. And that usually means that you found something that fits into your lifestyle well. So I hear a lot of times that a lot of women were started on the patch, but they love saunas and it doesn't stick well. Or they're surfers and the patch doesn't stick well, right? Or maybe they were given oral, but they always felt a little strange about that. Wish they had the patch or wish they had a transdermal. Or sometimes I prescribe transdermals, but then my patients feel as though it's not absorbing well or they're worried about it transferring to other people in their house. So ultimately, this is really individualized as well. But I always say you want to make sure that your hormone replacement therapy fits consistently into your lifestyle so that you don't forget it, you remember to take it on time, it's really easy, you can travel with it. If yours is not something that really easily fits into your lifestyle or that's really convenient for you, you should absolutely be talking to your doctor about switching this, because ultimately, just like most things in life, if it's just really hard to get into your daily regimen, ultimately you're going to forget it, you're gonna stop, and it's just therefore not gonna work for you. All right, so those three things are really important to determine if your HRT is working, if your HRT is right for you. And again, we talked about 70 to 80% improvement as number one, limiting side effects as number two, and number three, something that fits into your life. But there's a bonus one that I always tell my patients about, and I want them to feel really confident about their HRT regimen. Now, sometimes that means, your mom might say to you, I can't believe you're on hormone therapy, and you say, oh no, let me tell you about the safety data. Or it may be that you're afraid to tell your best friend that you went on hormone replacement therapy. Or you're afraid to tell your other doctors that you're on hormone replacement therapy. And so I always aim to arm my patients with all the evidence-based information and knowledge and really improve their confidence levels about the safety and efficacy of hormone replacement therapy. That's just something that psychologically is going to keep you feeling strong, is going to keep you feeling excited, and is going to keep you on your HRT regimen and going really strong. This is really important because for whatever reason, hormone replacement therapy has become controversial. Not that it's just FDA approved and the best and most effective way to treat menopausal symptoms, but also a lot of people seem to have opinions and biases about hormone replacement therapy. So my bonus for you is that you feel confident and cool and collected when talking about your HRT regimen to others. Now, if you didn't know, if you become my patient, I also give you a complimentary copy of my course, the Reclaiming Menopause Masterclass, which goes through this in absolute detail. But the Reclaiming Menopause Masterclass is always available to purchase no matter what state you're in, no matter what country you're in. And I would absolutely love if you wanted to check that out. Links for that are also in the description below. Let me know if you found this video really helpful. What point was interesting to you? What point did you not know about before? And really, what are your goals for midlife and menopause? What makes you feel good? If you found this video also super helpful, please feel free to share it to a friend, put it on your socials, and subscribe to the channel. Thank you guys so much for your support, and I'll see you next week for a brand new video. Bye, everyone.